Ladies and gentlemen, it's my real pleasure to introduce this webinar and to open it, a webinar that is focused on health literacy in schools, and the subtitle is An Asset for Education in the 21st Century. And this is extremely important to ask the question of the relationship between health literacy and schools. This webinar is co-organized by the UNESCO Chair Global Health in Education, the School for Health in Europe Network Foundation, the universities of Fulda, Bielefeld, and Jyväskylä and Clermont. And we are really happy to have three key experts in the field at the global level. The aim of this webinar is to discuss health literacy in school context and also in the educational sector in general. Of course, education is larger than only schools. Health literacy is clearly absolutely critical in this 21st century as key competencies for the citizenship in order mostly and especially to help them to critically evaluate the health information, to make informed choices and decision about health, and also to inform their health behavior. We're going to ask you to contribute to this webinar through the different questions you could ask with the chat box, with the Q&R application, and also by logging you on www.wooclap.com/HL in schools in order to answer question about the keywords. What is your vision of health literacy in schools, and also the way in which health literacy is addressed in your school system as a subject or as a cross-curricular theme, and also the way in which health literacy in schools is linked to the other subjects. We're going to, of course, launch these different questions. We are very happy to welcome three very well-known colleagues. Leena Pakari is Associate Professor at the University of Jyväskylä in Finland. Orkan Orhan is a PhD holder, and he works for the Faculty of Educational Sciences of the University of Bielefeld, and also Kevin Darazinski, he is professor working at Fulda University of Applied Science. All these three researchers are among the top researchers in the field. They published a lot of key papers and some of what I could call the Princeps papers and books, and we are very happy to welcome them today to answer your question, our questions, to link to health literacy in schools. As I told you, we really would like you to answer this first question using the application www.wooclap.com/HL in schools. And please do not hesitate to try to contribute to the discussion through the application. Now, Dr. Orkan Orhan, professor at Bielefeld University in Germany, we just really would like to ask you, what is health literacy and why do we need to address health literacy in schools inside the school system? Professor Orkan Orhan, your turn.
Thank you, Didier. Also, thank you, Sylvia and Annette. I hope that you can hear me loud and clearly. I'm very happy to be here, and I will now start sharing my screen with my presentation. Just let me know if you see it.
Yes, you can go ahead. This is just perfect. So, Professor Orkan Orhan, please.
It's doctor, it's not professor. Okay, great. So I will talk about what is health literacy and why do we need to address health literacy in schools. And I will start with a very basic definition on personal health literacy, saying that health literacy is linked to literacy and it entails people's knowledge, motivation, competencies in order to access, understand, appraise, and apply health information in order to make decisions in everyday life. So this is a common definition, but of course there are various different conceptual understandings available, but this pretty much nails it. And I want to give a practical example looking on these different information processes. So for example, a child is searching, finding and accessing information, for example, on healthy eating in the media. And after accessing the information with health literacy, the child begins to understand messages and claims made in the media, for example, on Twitter, on Instagram, or on some web pages about healthy eating. And by appraising information, this means that a child critically assesses the claims and identifies possible fake news in order to use this newly gained knowledge to inform own decision-making about eating and nutrition, inform health behavior and health action. But this, I call it personal health literacy on top, has always to be seen in the context of the wider environment. So health literacy is always embedded within a social environment of the child, and the conditions, the pre-existing conditions in an environment have an impact on how or how not a child and adolescent can apply health literacy, which is displayed with this figure. And in health literacy research, from this theoretical idea emerged the concept of the relational model of health literacy, meaning that on the left-hand side, we have the individual competencies, so the behavioral and action components of health literacy within the personal approach. And they have to meet on the right-hand side the structures, conditions, and the determinants of health and the so-called organizational approach in order to ensure the best health outcomes and the best health literacy action. And in this context, besides personal health literacy, over the years emerged the concept of organizational health literacy, which means that this is the degree to which an organization, for example, such as a school, equitably enables individuals, in this case children, to access, understand, appraise, and apply health information to make judgments in everyday life. So you see, we have on the one hand the personal approach, and on the other hand the organizational approach, both of which have to be considered jointly in order to get the best results. And what we know from research is that low health literacy in children and adolescents across studies is associated with lesser health knowledge, with more unhealthier behaviors, with poorer mental health outcomes and status, and problems in engaging in health communication, and problems in dealing with information. And what we also know is that low health literacy follows a social gradient. That means that a lower socioeconomic family status of a child is often associated with the higher probability of lower health literacy and health knowledge in health literacy in children and adolescents. And this has been shown in studies in primary school-age children as well as adolescents, for example, in the HBSC study or German study on digital health literacy. And for more information on these issues, you can, of course, access the books that I just displayed here, the International Handbook and the New Approaches to Health Literacy. And when we look on health literacy in the time of COVID-19, which of course is the current crisis situation that is accompanying us for the past 12 months. What is health literacy good for in this context? And I would say that health literacy enables children and adolescents to participate in risk and health communication about the coronavirus. They can acquire and use knowledge about the coronavirus. They can understand and apply the behavioral recommendations given by the public health authorities, the health ministries, or the health education agencies of governments. They can access and evaluate claims made about coronavirus and COVID-19 on social media, internet, on other media channels. And very importantly, they can, through health literacy, recognize fake news, disinformation, and misinformation, which is a very serious concerns, which that the last year has shown us, because we have the problematic infodemic, and health literacy can be used by children and adolescents to navigate this infodemic. And the question is, what is the infodemic? It is not a new term. Actually, it was introduced back in 2003 during the first SARS-CoV outbreak in China. And it means infodemic is the short for information epidemic, and it means that there is an overabundance of specific information on a specific topic, and some of this information may be right, others might be not, might be like fake news or misinformation. And they are often also accompanied by conspiracy theories and false claims, which we can, for example, see on especially on Twitter, but also on other social media challenges where channels where we have lots of conspiracy theorists spreading information that the virus was fabricated in a laboratory, etc., etc. And these information environments can be overwhelming to people, so making it very difficult to take the right decision. And this leads to problems, for example, in dealing with this kind of information, which is why health literacy is important. And a recent study in Germany on the infodemic in adolescents and children found that children and adolescents report to encounter lots of fake news on the internet and social media, especially on the false claims regarding the coronavirus. And they in particular expressed their wish that this topic of fake news and health literacy is being addressed in schools, meaning that this is a new topic and which is not covered in schools yet, or not in a systematic way as it deserves to be. And when we look on health literacy in schools in the past year, we have undertaken some evidence synthesis on the evidence available on health literacy in schools, and published, for example, with the Schools for Health in Europe network, the state of the art on health literacy in schools, or with the International Health Literacy Network, the concept paper covering broad aspects on health literacy in the school settings. And we were able to identify some challenges and barriers across these approaches. First of all, although health literacy has been out there for a couple of decades, it is a relatively new concept to schools in a systematic way. In almost no country there is a mandatory curriculum or any educational policies ensuring that health literacy is addressed in schools. Of course, you will learn some exceptions in the following presentations. And another problem is that health literacy is a topic that can easily be addressed in school health education, but not all schools use health education in their setting. That also means that not all teachers are trained on health matters. So there is need for capacity building, professional capacity building, and teacher development. And last but not least, the mandate of school is to provide education and not health. And this is the reason why the school curriculum is already overcrowded with their mandatory subjects and topics, which altogether makes it difficult to introduce health literacy into it. This means that there is a need to address health literacy in research and policy, but especially in school practice. And on my final slide, I will show you an intervention framework for health literacy. And I have outlined this area, the school-aged area, where I believe that some critical components that needs to be in place in order to successfully address health literacy in schools. For example, we need a whole school approach like the health promoting school framework. And especially COVID has shown us that there is a significant lack in the infrastructure, especially in the digital infrastructure and software, homeschooling, online learning, etc., that needs to be addressed. Teacher training is an important issue, and workforce development, curriculum, and about curriculum you will learn in the next presentation, and classroom teaching. So these are very, very important aspects that needs to be in place, and you can see that we cannot only look on health literacy in a school setting, but the conditions in early childhood must be in place in order to ensure that children receive the optimal development, in order to ensure that they can acquire the skills and competencies necessary for health literacy in the life course.
Thank you so much. Thank you so much, Orkan Okan, for this extremely clear talk, which is absolutely excellent, because you were able to summarize in very few minutes where we are in relationship to this question of health literacy in schools, but also from a life course perspective. And it's extremely important to put together the long-term, the lifelong perspective, and what is the specific role of schools. So I'm back now to Sylvia de Ruyter to know more about the question asked by the participants. Sylvia, what are the question, concerns, and suggestions of the participant to this webinar?
Thank you, DJ. We've got a question that how can we reach children through their preferred mediums on online social interaction, like TikTok and Snapchat? Because they're getting a lot of information from these media.
This is a very important question, and probably we can enlarge a little bit the question, because it's the question of the formal education and the informal education and the way in which other information reach the students. Okay, Noran, what could you say about this key question?
Yeah, so first, of course, social media plays an important role in communicating about health. There are lots of information available. Children acquire knowledge there, and they are kind of influenced by people sharing information on these channels. TikTok and Snapchat are two channels, Twitter, Instagram, Facebook, and all the other social media channels that are there. They have to be in the focus of interventions regarding health communication. And if these platforms are those platforms that children mainly visit to access health information, of course, we have to focus on these platforms as well and make health information and channels appealing to children, and also use the same channels, we have to be in the same social environments and everyday worlds that children are in order to get them. And of course, these kind of social media approaches can be addressed in schools, for example, in learning about media education, media literacy, information literacy, digital literacy, so that children from an early age onwards learn to deal with these platforms, but not only with the platforms or the software or the content themselves, but also with the hardware, the digital devices, the rights and responsibilities associated to that, how they present information that they acquire there, how they fact check what they read there. And I think this is not only the role of health literacy, but health literacy in combination with lots of other educational concepts. And I believe that teachers, parents, the whole school and the whole environment of the child, the community, has a responsibility to play. So it's an approach for many hands.
Yeah, thank you so much, Organoran, to remind to all of our participants that it's not TikTok against schools, but part of the education of every young people. There's part of the relationship with the information that comes from outside, and TikTok or Snapchat are not negative, they are just part of the world and then part of the education. Sylvia de Ruyter, other questions for the Dr. Orkan Okan?
Yes, we've had other questions. Is there a risk that we, through the concept of health literacy, see children and young people as part of the problem instead of viewing them as part of the solution?
Oh, thank you so much, Bjarni, for this key question, because there's very often when it's about adolescents and children to have a kind of negative view. How could we avoid that kind of risk? But what about the risk of seeing health literacy as something that, used to change the behavior of the adolescents and the students in general, instead of considering them as a key mean to change and to promote health? Orkan Okan?
Yes, this is a very good question. I believe that we have to view children in regard to children in their own rights. So it is all about being subjects, not objects, them being equally participating in what we are doing. They're the main drivers of their own life. They know best their wishes, their interests, what they attracts them, what they want, and we have to include them and never see them as a risk, but as an opportunity, as a solution. And we have to, if we, for example, develop an intervention, or if we aim at a health communication campaign, we have to include them. If possible, we have to let them drive this, because they can affect other children as well. They are more socially related with others, and they know their peer best. So it's all about participation and equal opportunities to let them be part of it.
Thank you so much. This is again extremely clear. The participants could have a look on a lot of very interesting experiences that are led in different schools, where you have examples of schools and teachers and students who base the health literacy programs on the capacity of the children and young people to transform themselves, the world around, and to contribute to promote health. Sylvia de Ruyter, can you share with us the results of the WOOC Lab to see what are the keywords for the participants of our webinar? Okanohan, can you have a look on the on what our participants did in order to see if it fits with the vision you have of health literacy?
Yeah, it totally is. I mean, it's obvious that we see HTTPS and www as the biggest letters, the biggest words besides health literacy. I think everything is covered, but these two, they perfectly demonstrate that today health literacy is a very important tool to navigate online information, media information, because everything now is due to digital transformation, and especially digital change, bringing online content right into the pockets of children through the tablets and smartphones and the apps there. That this is a very important medium, why we need these kind of digital skills, digital health literacy skills and navigational skills for children to be enabled to be the masters of their own health development.
Thank you very much, Okano-kan. Thank you to all the participants. Now we're going to move to the next speaker and the next questions. After having listening to our first speaker on the definition of health literacy, now we need to move to the question of the incorporation of health literacy into the school curriculum. It means that using the glasses, the lens of the schools to understand what could be the specific space of health literacy. We would like you to come back to www.wooclab.com/HL in schools to answer the following question. Do you address health literacy in schools as a curriculum subject or a cross-curricular subject? Now, Lena Pacari, can you tell us more about health literacy in the school curriculum?
Yes, thank you for the opportunity to take part in this webinar. So various national and international public health measures to decrease the spread of the COVID-19 have highlighted the importance of teaching school-age children different health literacy competencies, such as how to wash hands properly and how to act if one recognizes the symptoms that might relate to the infection. Similarly, the importance of teaching the skills to handle the infodemic and to take social responsibility have been highlighted. When quick reactions and changes in people's daily habits were called for, health literacy of the population, including the school-age children, became and still is high in the political agenda. However, the quickly spreading virus clearly showed us the importance of addressing health literacy as a proactive measure. Several competencies take time to develop, as does the creation of the infrastructure and other conditions for such development. Reacting is good, but may be insufficient within certain time limits, whereas proactive measures build more prepared means to meet the complexities, uncertainties, and sudden challenges or problems. Health literacy could be seen as everyone's right. It is an important determinant of health and linked with health disparities among adolescents. Furthermore, it is an asset that fosters development of autonomy, empowerment, and participation in promoting common good. Next slide. International comparative studies have shown that there are differences in health literacy levels between and within countries. These two figures show some findings from a 10-country comparison using the data from the Health Behavior in School-Age Children study. The analysis showed that every fourth has difficulties in assessing the credibility of the health information and in comparing the information gained from different sources. And the differences between the countries are clear. When, for instance, around 30% of the adolescents in Germany report difficulties in assessing if the health information is right or wrong, the corresponding figure in Finland is around 14. So abilities to think critically and to find reliable information secures genuine access to and power over the knowledge and knowing. So we could propose that one explanation for the situation in Finland could be the fact that we have an independent and obligatory school subject called health education, where together with subject and other subjects and cross-curricular themes, these types of competencies are learned. However, more research is certainly needed to confirm this argument. And next slide. So between the countries and regions, there are differences in the ways school curricula have been developed and structured. However, at the general level, we could argue that school curriculum echoes what is valued in the society, such as what competencies will be developed during the school years and for what purposes. Furthermore, the curriculum may give a firm guidance for organizing teaching in an age-appropriate manner and a national curriculum for developing the local curriculum. So according to UNESCO, the curriculum is the central means for enacting the principles of inclusion and equity within an education system. As health literacy is linked with the health disparities, the learning of health literacy competencies at schools, and here by taking into account the individual needs, surely follows these principles. However, if health literacy curriculum is offered only in some countries, states, or schools, it may help in minimizing the health literacy differences only within those contexts. To reduce health literacy differences at the global level would require more ambitious aims and to introduce such a curriculum in all schools. So here we shouldn't forget that first, schooling in general should be secured for all children, as currently there are striking inequalities in education provision. And next slide. So currently only some countries, regions have explicitly introduced health literacy in their curriculum. However, a closer examination could show that several other countries do have some elements of learning of health issues in their curriculum, but they don't necessarily call it as health literacy. Anyways, there are different ways in which health literacy can be addressed in a school curriculum. Some countries have an independent and obligatory school subject, which is built around the core competencies identified for the health literacy. Some countries, on the other hand, teach health literacy as a transversal competence or as a cross-cutting thematic area that should run through the different subjects. Sometimes health issues are combined with other subjects such as physical education or thought as part of so-called career subjects like home economics, when a special emphasis will be placed on teaching some health issues during the career subject lessons. Surely there are pros and cons for various options. If, for instance, health literacy forms as a cross-cutting thematic area, it has a potential to be focused on several times in a week throughout the school years and to bring along health aspect into various subjects and perhaps even into daily practices at schools, to mention some. However, this would require that health literacy should be handled in all subject teacher or other teacher training programs. Teacher training is key to support that teachers become genuinely aware of and committed in teaching such transversal competence and gain qualification to teach and integrate it into their main teaching subjects and with an age-appropriate manner. On the other hand, if health literacy forms as an independent and obligatory school subject, it has a potential to reach the same status as the other subjects. Often schools are organized around the subjects, and if health literacy or related subject would have the same status as other subjects in the curriculum, it is more likely that it will be offered enough commitment, time, and resources to conduct such teaching in a purposeful manner. Furthermore, it is more likely that related teacher training programs could be developed. Similarly, however, it may it may be that the teaching and handling of health issues is left in the hands of those subject teachers only, and the schools will not necessarily adopt health literacy and health as part of their broader missions and practices. Certainly, the curriculum where health literacy and health are in different roles, such as both subject-bound and cross-curricula, could be introduced as well. One clear benefit for curriculum approach is that as compared to short-term and extracurriculum interventions, school curriculum ensures longer-term emphasis on the issues that are included in it. After all, often the curricula are developed for several years forward. And next slide, please. And so with this slide, I want shortly to give an example on how health education and health literacy can be seen at the system level. And the case is from Finland. So in Finland, the subject to be taught in schools are law-based, as is the amount of university level studies required for to be qualified as a subject teacher and the amount of hours to be allocated to various subjects in different grades. When health literacy was named as an obligatory subject to be taught in schools, it meant also that related teacher training had to be established. These acts frame the national curriculum development, which serves as a guiding document for local curriculum development. Health literacy is used as a theoretical and a guiding framework for identifying and defining the goals for the health education instruction and the assessment criteria for the competencies that pupils should master in certain grades. In Finland, there are various publishers who produce textbooks and teacher materials to support teaching and learning in school subjects, including health education. All of these together influence on the way teaching and learning of health issues and health literacy will take place at schools. However, though a school curriculum is an important and powerful educational document, and schooling has the potential to even out the differences in, for instance, cognitive skills that might be conducive by the different out-of-school contexts and influences, important is what happens at schools. And next slide. So to sum up my presentation, I would like to share you the talk made by James Coleman in 1968 when he wrote an essay on the concept of equality of educational opportunity. And particularly the sentence where he says that educational equality of output is not so much determined by equality of the resource inputs, but the power of these resources in bringing about achievement. And the next slide. Thank you.
Thank you very much, Lena Pakari. It was, as always, a brilliant talk. And now we know where we are going because you just raised many of the key questions linked to the relationship between health literacy and schools, which is not natural at all. And I saw that there's many questions. Sylvia de Ruyter, can you share with us some of the questions of the audience, please?
Yes, thank you, Didier. We've had several questions. One of the questions is related to the parents. How can we empower them to deal with disinformation and fake news and in helping children to deal with this? And we have a question related to developing countries. How are we integrating them in the health literacy, especially in this area in which digitalisation is more and more important, and a lot of schools and in most countries, and Zimbabwe in particular, are still struggling with their internet connectivity. Mm-hmm. And the last question is, how do we know anything about the kinds of competences a teacher needs to be able to develop to help children and young people to develop health literacy skills?
Thank you so much, Sylvia. Lena Pakari, perhaps begin by the second question, which is very wide. It's more a question of the global point of view. You know, the school systems are built on cultural representation, cultural views that are very different, and also the resources, the social space of the school system in the social life is very different. How could we move forward at a global level in the different countries? How to push forward the development of these citizenship skills that are the one of the health literacy? Lina?
Well, that was quite challenging and tricky question, I have to say, but thank you for it. And first of all, I would like to say that it's ethically right to expect that all children should achieve the same level of health literacy, despite of the country or background or whatever context they live. But of course, the path to achieve that to the same level are and might be totally different, and they should start with the key challenges that are at hand in their local context. So at least actually, I think that many citizenship skills are actually more targeted in many developed countries because actually they are in the books that I have read, at least, and the papers, they are. It seems that they are more kind of connected with each other. So they actually are kind of collecting good, wondering about what might be hindering health in their surroundings and what should we together do in order to be able to develop, the area and the health in the local area into better direction. So perhaps they are not that much struggling with the social media issues, but certainly they are developing already their citizenship skills. And I would even say that they are perhaps even better in that area than in many other countries, where perhaps we have moved from the collective, focusing on the collectives towards more individualist directions. So,
okay. Yep. Thank you so much for your answer to this very complicated question. Yes, clearly there's differences, and I don't think that we could judge a school system in its ability to develop health literacy only on the basis of the sticker of the label of health literacy. We have to go inside and to see what about the skills, what about the competencies we need to improve the health literacy of the children and young people. And you're probably right. It's more a cultural issue than just the comparison between the developed or the low income, middle income, and high income countries. So exactly. Now the second question was about the role of the parents and probably also the role of the community. How could we empower the parents and the community? How to create coherence between school and what's outside the school in relationship to the competencies linked to health literacy? Lena Pakari?
Well, here I have to say that this is something that we have started to study just in our new research project Critical, where we are actually studying about the role of the parents and families in contributing the learning of critical reading, internet reading skills and of the adolescents at schools. And there we are actually trying to indicate the factors that influence on the learning and try to influence on the family level factors, but also individual dispositions. So, but also we are targeting the surroundings, the libraries and the other settings where also such a kind of joint learning could happen. So, and also the collaboration between the families and the schools. So I wish that perhaps after a couple of years after this webinar, we are wiser in the topic, because this hasn't been studied that deeply. We know that at least in Finland, there are different kinds of practices between the schools. Some of them are more active. They give tasks for the parents and families through the Wilma, that is the application, school application that schools use to contact parents and other ways as well. So they give joint kind of tasks for the kids and parents to discuss about, for instance, current health problems or health findings that have been just revealed. But in some schools, they don't do that. So there are differences. But at the moment, we are going deep into the topic in our new research project.
Thank you so much. I suggest that we leave the question on the teacher competencies to Professor Dadasinski. Sylvia Dorotheur, can you share with us the results of the pool we made on what I would call the positioning of a day health literacy in the schools? We have around 100 participants to this webinar on Zoom and also on YouTube. What we know at the time is just only few people contribute, but we can see that it's, I would say, close cross-cutting issue or a curriculum, a subject. It depends on the country. I suggest now to move to the next speaker, to Professor Kevin Dadasinski. Professor Kevin Dadasinski, we really would like to ask you how to, include this health literacy approach within a bigger framework, the one of the school health literacy, the framework of the school health promotion, sorry, because we all know that the question of what happened in school as a setting and also as a place for education, these two dimensions are linked. And we really would like to ask you, dear participants, to contribute on www.wooclap.com/HL in schools to tell us if you personally or in your country address health literacy in one or more of the following domains that are on the question. Professor Dadasinski, so it's your turn. Can you tell us how to embed health literacy into school health promotion frameworks? And you can see that there is an S at the end of frameworks. Professor Dadasinski?
Yes, thank you so much. Great to be with you today. Just open my slides. A second, please. Does it work for you?
Absolutely.
Perfect. Yeah, great to be with you today. As you asked for, I would like to at least discuss, although I have not the single answer for you, but I would like to discuss a little bit how we can embed health literacy into the school health promotion framework. But before doing that, I would like to introduce a little bit the health promoting school idea or the framework. And all of you who are concerned or work with the health promoting school approach know very well that there's no common definition, there's no common understanding on what constitutes health promoting school. What we know at least is that health promoting schools are very complex interventions as they move beyond individual behavior and also include organizational change, for example, through strengthening the physical and social environment by including interpersonal relationships, school management, policy structures, or teaching learning conditions. So you see, it's very, very complex. When we do that, it's not just a single one measure that leads to a certain outcome. It's a whole bunch of complex array of measures that we do within the health promoting school approach. The World Health Organization favors the health promoting school approach since many years. And as you can see it here on the right side of the slide, the WHO has formulated some key features or elements of health promoting schools. And what you can see on the right box or top right box, you can see this is this one here. This is to provide skill-based health education. And obviously, this is one component where health literacy can be embedded to provide the skills that are needed for health and health promotion. But anyhow, it's very important to see and to reflect that health promoting schools is much more than skill-based health education. The same should be true for health literacy. Health literacy should also be included in every single element in every single box that you can see here in this figure. WHO, or according to the WHO, a school is a health promoting school when it fosters health and learning with all the measures at its disposal. And this is very critical. It's critical to understand that health promoting schools do not only strive for health, they see health and health promotion as a kind of input factor to enable learning, school quality, and educational outcomes as well. So it's important to see that both is very intertwined. Moreover, it engages health and educational officials, teachers, students, parents, etc. So it's important to see that the health promoting school is a multi-stakeholder, a multi-target group approach that strives to provide a healthy environment, school health education and school health services, which refers exactly to the elements which can be seen on the right figure. And finally, it tries to improve the health of school personnel, families, community members, as well as pupils. And again, it's very important to see that the health promoting schools not just focusing on the health of pupils, but also on the health of school staff and all those who are concerned with schools. All of you who are a little bit familiarized with Schools for Health in Europe network know that there's a tradition that we have regular conferences, European conferences on health promoting schools. And the last one took place in Moscow in 2019. And one of the results of the conferences is the so-called Moscow Statement on health promoting schools. And that statement emphasizes that all approaches such as health literacy approach, but also other approaches such as action competence, salutogenesis, and all these other approaches are important approaches of the health promoting school approach. They should not stand or compete each other in any way, rather more they should be integrated in a holistic framework of health promoting schools, also to avoid that or also to result in a very coherent communication structure or intervention structure for schools. If we present schools with different concepts and ideas, this is not perceived as a coherent structure, and it does not make sense as well. I would now like to come to the health literacy of school educators and their role in school health promotion. What you can see here is not an extensive list, but it's a short list of studies which tried to examine health literacy of school educators. And here you can see the percentage of those educators having a low or limited health literacy. You can see that the percentage ranges from 29% to almost 50%. So the first indication or the first argument would be, although this occupational group seems to be a highly educated group, it's not the case that we do not see any needs for health literacy promotion for this group. You see the variance is quite high, and we cannot directly compare all these different results because they focus on pre-service teachers, on school principals, and they use different instruments. However, it seems a little bit that males or male educators have a lower health literacy, and the same could be observed for those who are a little bit younger. And based on our study that we conducted with school principals, which is the last one here on this figure, we could find out that most difficulties we could identify most difficulties for assessing the reliability of health information and in finding information how to manage mental health problems for school principals. And interestingly, there are significant associations of health literacy with mental health and health promoting school implementation. This would be the next slide. This is based on our study that we conducted here in Germany with school principals. What you see here is we differentiated, or we did a stratified analysis for those having a limited health literacy and those having a sufficient health literacy. And you see that those reporting a limited health literacy also having a lower mental health status for well-being, health complaints, and emotional exhaustion. And the differences are quite high. If you look, for example, on health complaints, this is a 20% difference between the two groups of health literacy. Another argument that I would like to bring in is that there is a relationship between health literacy, in that case again of school principals, and the level of health promoting school implementation. We asked school principals to indicate whether certain elements of the health promoting schools are in place in their school. And what we could find out is that those school principals having a limited health literacy also tend to say more often or to report more often a low level of health promoting implementation. This is an argument to say that health literacy is very much associated with holistic approaches on school health promotion. So when we did some stratified analysis, we could see that this is particularly true for male principals. And we could also see that other variables or other factors, such as health promoting school competencies and attitudes, also serve as strong predictors for health promoting school implementation. So that means health literacy is one among many contributing factors on school health promotion. Those who are dealing with different issues on school health promotion know that there are a lot of different indicators in place. We have them on a global level, we have them on a European level. So this is just an example for European standards and indicators, and it gives schools a good support on what needs to be done in order to become a health promoting school. For example, if you look at these indicators, they comprise 8 standards. And if you look at the outcome section, you see that health literacy is embedded in standard 7. It is operationalized as an outcome. And this is quite correct, as also emphasized by Lena. But in order to achieve those kind of outcomes, we need to do something in the section input and also in the section intervention. And how we can do that is displayed here. We could use, for example, the health literate organizations. This is an approach that comes from the healthcare sector and which formulated or which defined 10 attributes of a health literate organization. I don't want to go through all of them, but what we can now do is to look for possibilities to transfer this idea to schools. And just one example, there are maybe others as well, is a German project which is led by Orkan Okan from Bielefeld University, the Gecko Org School Project. What they try to do is to translate the idea of health literate organizations to schools, and they try to develop and pilot test a self-assessment instrument to enable schools to identify gaps or some areas which need further action to be a health literate organization, and with it to become a health promoting school. If you want to find out more, there's a web page which you can check. It's on German German language only at the moment. So to sum up in a way, we can come up with let's say a kind of framework for health literacy and health promoting schools, which is very close to health promoting schools. First of all, we can say health literacy in schools need action on a curriculum level. This is what Lena already introduced and talked about. So we need a systematic integration of health literacy into subject areas and curricula, but we also need the development of materials and concrete didactics. We talked a little bit, or I talked a little bit about the school stuff, and I could show a little bit that there's a need to strengthen the health literacy of school stuff to enable them to provide health literacy at the curriculum level, but also to promote their health as well, because we see that health literacy and health is intertwined very much. I talked a little bit about the school environment. Health promoting schools is also an environmental issue, and the same holds true for health literacy. So health literacy should be addressed also on an environmental level. For example, by using these indicators which are now developed, for example, in the Gecko Org School Project. And what I've not talked very much about, but what would be very, very important is to also look at the wider school environment. Schools are just a small part within a bigger community. So it would be very important to build sustainable collaborations with community stakeholders in the area of health and education, social service, to allow more cooperation with parents and also to enable exchange with schools. We have not very much evidence on that, but we hope to build it up in the years to come. And finally, as it is the case for the health promoting school approach, we need to use the health promotion principles. And this is a direct, maybe let's say a direct answer to the comment Bjarne has posed at the beginning of this webinar. I think we should see this as a possibility. Health literacy is not about problems and how we can overcome problems. This is also part of that, of course, but we want to include it as in a positive concept. We want to address health literacy in a very positive way by focusing on participation, on equity and inclusion, and on empowerment. Thank you.
Thank you very much, Kevin Dalasinski. It's just a brilliant talk, and I think it answers many of the questions we already have. I'm back to you, Sylvia de Ruyter, for the different question. Can you summarize the question we have for our third speaker, please?
Yes, thank you, DJ. Well, we still had the question about the kind of competences a teacher needs to be able to develop children and young people's health literacy. And we have another question that's, if teachers are still struggling with new technology, especially in developing countries, how can they cope with health literacy on top of other critical topics?
Thank you so much for this question. And we saw in your last slide that the second domain of improvement is the increase in the capacity of the school staff to teach and to educate in the field of health literacy. Given that, I think, what are the competencies and what could we do in link to another literacy, which is the digital literacy of the school staff? Where are you? Where are we at the time?
With regard to digital health literacy, I just can give you an example from Germany. This is a very important issue because it's not the case that in Germany, for example, in German schools, that the infrastructure, the technical infrastructure is quite well. And with the missing infrastructure, and I'm sure it's the same in other countries, and with the missing infrastructure, we cannot expect that teachers can appropriately deal with those technologies and to support children in building up these competencies. So it's not enough to focus on their literacy levels. It's also important that we build up the infrastructure for schools on that. So that would be necessary. So and I'm pretty sure this is not just the case for developing countries, of course, with a higher amount, of course, or with a higher priority, but it's also the case for developed countries. This is the first thing. And the second thing, you asked a little bit what kind of competencies are needed on health literacy. This is not very easy. And again, I would say we should link the competencies that we know we should focus on for health promoting school with the competencies on health literacy. It's nothing that competes each other. We have a lot of studies. Didier, you did very good work in that regard. And I think we can apply the same idea to the health literacy field. We don't need to reinvent the wheel all over again. So it's already there. We need to slightly adapt it a little bit to the health literacy needs, but we can use all frameworks which are there, all elements on health education for teachers.
Thank you so much, Kevin. What you just say is absolutely critical. No need to reinvent the wheel. There's a lot of things that are clearly related to health literacy. I just have a question, which is going to be the last question of this webinar. What do you think about the impact of the COVID-19 crisis on health literacy in schools? I mean, is it an opportunity to try to make visible all what is done in schools about literacy, health literacy, under the banner of health literacy? It means what is done in health education, what is done in relationship to the citizenship competencies and all that stuff. What do you think? Is it an opportunity? Just few words, and then we're going to conclude.
Don't be confused. This is my clock. Yeah, I think the COVID-19. Ironically, it's a booster for health literacy as well. And I would say it's not just a booster for health literacy, it's a booster for all health promoting efforts which are done in school. And it's a sensitive time frame. It's like a policy time frame that we should use for our activities. And it's very important that we now switch to a positive public health perspective. So the whole discussion is very much characterized by the medicine, by the field of medicine or medical disciplines. And what we should not do is to be quite quiet. We should not be quiet. We should be very loud with our health promotion perspective. And I think then we can use, or we can use this time-sensitive period for health literacy.
Thank you so much. A kind of a trigger or more comprehensive changes probably at the school level. Just would like to thank again the speakers, to thank again all the partners and the participants who take part to this meeting. Would like to remind you that we have a fact sheet, the fact sheet of the SHE network. You can find it on the website and you have the link in the chat box. Don't forget, there will be a web page on the website of the UNESCO chair, on which you will find the talk of our speakers, some resources, some very important links, and there are slides, and also the possibility for you to ask questions to our speakers. The next webinars of the UNESCO chair, the next one is in March, the 25th of March, on a health inequality among the adolescent population with Susan Sawyer and colleagues. And after that, it's going to be a webinar on health promotion nowadays. Thank you so much to all of you. Looking forward to see you again in the next webinar. Thanks to our speakers. See you in a next webinar. Goodbye.
Thank you, Didier. Bye-bye.